I was first diagnosed with chronic pancreatitis in January of 2009 after my first attack. And it was incredibly debilitating right from the get-go. Over the years, I've tried a number of different what I thought were solutions. Sometimes they ended up being quick fixes, sometimes they didn't help at all. But I've had celiac plexus blocks, I've had the Whipple, I've had umpteen procedures, and I still was unable to eat without a significant amount of debilitating pain and nausea. So up until this point, just a couple of days ago, I wasn't able to eat without food, without pain or nausea since last April of 2016. So it's been a while, and prior to that I was on TPN, total parental nutrition, twice before for the same reason, being unable to eat without pain and nausea. It's completely taken over my life. So I'm grateful to be here. I had the surgery and everything went well, and the hospital's been amazing, and the teams have worked together seamlessly to make this a great recovery. And so 11 days after I've had the TPIAT, I'm hopefully going home. And I'm eating, and I'm happy about that. So it's a good feeling.
So, her course is not unusual for someone with chronic pancreatitis. Chronic pancreatitis frequently can be associated with alcohol abuse, but in about 40% it is not. And then these patients, first of all, are falsely accused of alcohol abuse, despite the fact that they may have, as in Leila's case, an underlying autoimmune disease, or they may have mutations, and the pancreas on CT or MR looks completely normal. So these forms of chronic pancreatitis are chameleon-like because no one really can make the diagnosis until much later. Chronic pancreatitis is associated with chronic pain syndrome, which forces the patients to use high doses of pain medication. Frequently, they become dependent on narcotics, on opioids, and that spiral of potential alcohol abuse and now drug abuse makes it almost unbearable for patients to be seen in the emergency room without the stigma of, well, they are obviously seeking pain medication and all they are interested in is opioid use. The pain is intractable in these patients, and whoever has operated on a patient with chronic pancreatitis knows that chronically diseased pancreas, which usually, is very soft in nature, is hard as a rock. It affects the nerves that are next to the pancreas, and the pain is a very characteristic pain. It starts in the upper abdomen and then radiates into the back. Patients are frequently not able, like in Leila's case, to eat or keep anything down, and she has been for a prolonged period of time of TPN, which is not uncommon, but which also has its own side effects. She underwent 2 surgical procedures in hope that the mid-epigastric and right upper quadrant pain could be relieved. That is a cholecystectomy, and then a Whipple procedure, which is a very invasive procedure to remove a portion or the head of the pancreas. And she did well in terms of post-operative management. However, the pancreas, or most of the diseased pancreas, was left in place. And the only way to cure the patient from the consequence of chronic pancreatitis or from chronic pain syndrome is complete removal of the remaining pancreas. And that's what we did. We did a completion pancreatectomy. And what we found was that about 70 to 80% of the pancreas was still left in place. And it looked remarkably well, which is also a sign of a chronically diseased pancreas if it is of autoimmune nature. You would not necessarily see major changes on the surface of the pancreas itself. The pathologist makes the diagnosis, as in Leila's case. But obviously, after we removed the pancreas, immediately, and even in the PAC unit, she already was describing the pain as very different from before. And then about 4 or 5 days after the surgery, we started her on oral intake, fluids first, and then a soft diet, and now more of a regular diet. and it's really for the first time in many months.
I don't even know when.
In
I've
many
been able
months.
to eat without a stomach ache or feeling like I was going to get sick or wanting to just curl up in a ball and just be away from the rest of the world. It has an impact on your life like nobody else can imagine.
And equally important is also that she herself was in charge of withdrawing the pain medication to the point that, she requires now minimal pain medications, and we are confident that within the next couple of months she will be completely off all of these medications. The cells that produce the insulin, in her case, were enough to make her insulin independent long term. We got about 400,000 islets, insulin producing cells, with a viability of over 90%. On average, a patient needs about 3,000 to 4,000 islets per kilogram to be insulin independent. Leila received more than these 3,000 to 4,000 units per kilogram. So we are very hopeful that she will be insulin independent, and her insulin requirement early after surgery really have proven that she requires very little, and her blood sugar levels have been almost ideal in a 80 to 120 milligram per deciliter range, which is exceptional for someone who was initially right after surgery still kept on TPN. So I think within the next few weeks, Leila, when she's at home, will be off pain medications and will be off insulin and have her life back.
As I'm hoping.
So TPN is a form of intravenous nutrition, so that the patient, if he or she cannot eat, keep the food down, cannot digest, still get the nutrients that are essential to stay alive. We call it TPN as it stands for total parenteral nutrition, given IV fluids and nutrition via a vein into the body of the patient. The side effect of it is that it can cause damage to the liver, particularly if it's given over a prolonged period of time. And in fact, when we were doing the surgery, we noticed that Leila's liver was soft, very soft, and that is usually a sign of TPN-induced injury. And if she were to stay on TPN for a prolonged period of time, the liver probably would have been damaged. The procedure to remove the pancreas is different in a patient with chronic pancreatitis and a Islet Autotransplantation than it is for a pancreatic cancer procedure. In a cancer procedure, we go after the blood vessels initially so that there is no further spread of tumor cells into the body and dissemination of the cancer within the body system. In case of chronic pancreatitis, we try to preserve the blood vessels until the very end, so that the islet, the insulin-producing cells, still receive the oxygen and the nutrition that they need, and they don't die before the pancreas is removed. So everything is done in such a way that the gland is isolated and dissected out, and then at the very end the blood vessels are clamped. Then the patient receives blood thinning medication so that there is not the development of blood clots within the organ that is to be removed. We clamp the blood vessels, we cut the gland out, and then we treat the resected pancreas as we do it in a donor procurement procedure. The organ is flushed with a preservation solution. It's then packaged in ice. It is transported to the laboratory. The laboratory then isolates these cells. That's usually a 4 to 6 hour process. By the end of the isolation, usually the construction in the patient is done and the islets can be given back. The islets are then infused into the liver over a certain period of time in order not to increase the blood pressure in the inflow vessel of the liver, so that the risk of developing a blood clot as a result of the increased pressure in this blood vessel is minimal. The prognosis is very good. These are her own islets, so they will not be rejected. The chances of losing additional islets after the first 1 or 2 weeks are very small. So most likely all the islets that are in the liver now and that are functioning will continue to work over years to come. The goal of the procedure is that a patient is not rendered diabetic, but that the patient is off insulin and does not develop the long-term consequences or the secondary diabetic complications of diabetes, which affect the eyes, the kidneys, the blood vessels, the nerves, and so forth. Because if we did not do the islet autotransplant, the patient would be a truly brittle diabetic, more so than a patient with type 1 diabetes, which is of autoimmune genesis. The reason being that all of the hormones that are important for the metabolism of the blood sugar levels have been removed as a result of the total removal of the pancreas. There are cells that also interact with the blood sugar levels that are not insulin in nature. They're called glucagon and others, but they are all removed, and that's why this form of diabetes is what we call a very brittle type of diabetes, and has its own consequences in terms of morbidity and even mortality. Patients with very low blood sugars, called hypoglycemia, have a risk of death anywhere between 2 and 8% per year. And by giving her the islets, we have eliminated that risk.
We would also like to interview your mother.
Sure.
Ron, could you do me a favor?
Sure.
With Dr. Gruessner? Just a talk. The first, when he was answering your question,
Right.
I just for safety, because I heard static before I made that adjustment.
Mm-hmm.
If I could have him answer that question.
What was the question?
The initial.
Oh,
Well,
describe
yeah.
the procedure?
Yes.
If you could just describe the procedure maybe a little bit shorter.
Sorry about that.
Yeah. So the procedure entails the removal of the remaining or of the total pancreas, and it is done in such a way that the blood circulation remains until the very end, so that the islet, the insulin-producing cells, do not die off before the pancreas is removed. This is usually a complex procedure because, like in Leila's case, surgery was done before, and the removal of the pancreas frequently goes along with removal of the spleen, because the pancreas and the spleen share the same blood supply.
Hi, my name is Layla Balduzzi, and I am 39. I actually just turned 39. I kind of consider this a slightly late birthday gift. I am from upstate New York. I live in Syracuse. I am married to a wonderful man who has not left my side throughout this whole ordeal. I've been sick for a long time, and it's been very, very hard. I have a amazing 12-year-old son who has, again, kind of been in this with me from the get-go. I have, I'm a therapist at home by trade. I haven't been able to work in well over a year, so the disease took that from me too. But I'm here 9 days post-op of the total pancreatectomy and auto islet cell transplantation, and I'm doing well. So I'm excited to be here and excited about what's going to happen, and everything has gone beyond what we could have ever expected. So I'm grateful. And this is my mom, Ray. Her name is Relaine, but she goes by Ray because nobody can ever say that. And she's also been with me on this journey for a long time. As a parent, I can only imagine it would be really, really hard to see your child in constant pain and not even be able to do something simple like eat a meal. So she's been working along with many other friends and family to get me here, and she has slept in the chairs and of all my surgeries, and so now we're here and we're just hoping for a better outcome, you know, from here on out. It's only gonna go up. How's this been for you, Mom?
Well, the first time she had an attack with her pancreas, I kind of knew what was going on. But we were always looking for answers why they reoccurred, and no one could really give us those answers. We searched high and low, far and wide, and we could never get to the point where someone could explain to us why she was having these attacks. The answer always seemed just a little too far out of our reach. We kept going, we kept looking.
And I met Dr. Gruessner in February of 2015, just shortly before I had my second celiac plexus block that would leave me permanently unable to eat in April of 2016. So I met him. He came to upstate to where we were living and put on a presentation about what pancreatitis is and who it affects and what you can do about it and how your life can be normal again. And it didn't really seem like a real thing, but I worked with him and got myself in a really good position in terms of healthy otherwise. And I contacted him and I worked with his staff and here at the hospital, and everything got set up and put in place. And you know, when you've got to make arrangements to fly an organ from one place to the next, you know, all of that was done, and I don't think we had any worries at all the entire time that we've been here. Dr. Gruessner has been amazing, the team has been amazing, the hospital has been amazing.
Well, I think once we found Dr. Gruessner, I think we were really relieved. I think that is the word I will use. He has been so wonderful in terms of explaining things, how they'll work, what we should expect.
Answering questions before we knew we even needed to ask them.
The whole team has just been amazing. Dr. Schwartzman and Dr. Gruessner, I like to call them the tag team because they were both there 100% for us. If one wasn't there, the other one was. And they just gave us what we needed. We needed for my daughter to have a life that was pain-free, that she could enjoy her husband and her son and her family, and do the simple things in life we all take for granted, such as eating a meal and getting up and doing the dishes afterward, going out to a movie, going to have a cup of coffee, going to bed without having to run a TPN for 12 hours.
Which is a large bag of fluid. You sleep with a backpack full of fluid.
With a backpack on, and to constantly have to access her own veins, flush, clean, drain. And basically, we became mini doctors and trying to figure out the good, the bad. How do we do this? How do we manage this? How do we manage our lives around it? And really, I think the goal was to have her happy and pain-free. And
I woke up from the surgery and I knew that pain was gone.
And I think we've accomplished that. Our goal has been met, and it's been around 8 years in coming. And when we first asked her, when she kind of came out of the anesthesia, and we asked her if she had the pain, and she shook her head no, we all kind of got tears in our eyes, because that is really what we were looking for all these years. And we got it. And we'd like to thank all the staff here, because they were totally wonderful to us. And they gave us what we needed, and we're going to pass the word. This is where people need to be to find the answers to their chronic pancreatic pain.
Everybody from the second I walked in the hospital had a huge smile on their face. The cleaning staff, you know, the people who bring you your food, all of the nurses, all of the supervisors, all of the people here, they just have made this whole experience what I think it needed to be in order for me to get to the place where I'm at relatively quickly. You know, 9 days later, usually it takes a little while to come back from something like this. So I know that I'll still have some days, but those days are going to be different kinds of days. You know, they're just days where I have to let my body kind of catch up with what's happened to it. But it's not a permanent thing, which I never thought I would say. I never thought I'd think the pain would ever go away.
Well, I think when we originally came to this hospital, and we've been to many hospitals over the last 8 to 10 years, and we were always having to ask the questions and kind of try and stay on top of things that really wasn't our place to have to stay on top of. But in this case, those things were taken out of our hands. The questions didn't have to be asked because they were already answered. Mm-hmm. People came in and made us feel welcome. They took our worries away. They allowed us to relax and still try and be a little bit of a family. Even though we were in this situation, we felt comfortable. We could laugh, we could cry, mm-hmm. we could sleep, knowing that someone was on top of it to take care of things. Right. Even the custodial staff, very kind, wonderful, very helpful. The food service staff, incredible, from taking her order to making sure she needed the gluten-free products, that they were on her plate, mm-hmm. and the nurses, the therapists, and everyone, patient relations, they've all come to us and said, is there something we can do? Mm-hmm. Is there anything you need? Mm-hmm. And every time, no matter how small or how big, they answered it or took care of the problem without any hesitation. Mm-hmm. And that's like 5-star treatment. I felt like I was in like a 5-star hotel. Mm-hmm. Really, I did.
Which when you're in a hospital, you never get like that. 1 or 2 stars. So 5 is pretty good. You guys are doing the right thing.
You are.
My knowledge was somewhat limited about SUNY Downstate, other than to know that Dr. Rainier Gruessner had come here, and that I still wanted him to do my surgery. And so, ironically, my younger sister, who lives here in the area and is a photographer, took a new place to live conveniently 2 blocks up. So when I asked her to look up and see where the hospital was in regards to where she lived, she said, "You're not going to believe this, it's 2 blocks away." And so at that point, we kind of just knew, like, wow,
we hit the jackpot.
So we came here. We were here for pre-op in the beginning of November. Again, all the teams came together. They all explained how things were going to go, how, what your concerns might be, all the if, ands, or buts. Because, again, not everybody has, a perfectly favorable outcome, and I knew that going into it. All I could do was just hope that someday I wouldn't be in this much pain. And they just have gone above and beyond. Again, I can't say enough good things from everybody.
It's a well-oiled machine. Everyone worked together. The doctors communicated mm-hmm. with one another. The nurses communicated. Everybody knew what their job was. Nobody had to ask what to do. They did it well, mm-hmm. and they did it with good knowledge and honestly,
compassion and not a lot of invasiveness. They were always very like, "I'm sorry, I have to do this," but just wonderful people. I can't say enough good things about SUNY Downstate and what it's done for me and my family.
It's awesome. It's beautiful.
Again, I just wanted to get you guys, help you get this out and going, because there's so many people that are just waiting. They sit in their house and feel like this is never going to get any better.
They don't know it's here, and people need to know this is here. Mm-hmm. That's really why we're doing this, because we want people to know this is available. And it might seem out of reach, but it's not. There's people out there to help you get what you need. They're willing to go the extra mile to help you.
Because they want to see you better.
They don't want to see you sick.
They wanted to see us better.
They wanted to see her leave this hospital with a quality of life. Mm-hmm. And they weren't looking for a pat on the back. They were just looking to do their job and what they loved to do. And that was so evident here with everyone that was involved.